Do you ever wake up in the morning and notice it before anything else? Your mouth feels completely parched, like you've been breathing desert air all night? Your tongue feels stuck to the roof of your mouth, and there's barely enough moisture to swallow. If that feels familiar, don't brush it off. Because what most people in your family may call a small inconvenience, or just getting older, is often neither harmless nor normal. My name is NanoNexus Science, and for more than 2 decades working in senior health research, I've seen this one overlooked symptom quietly contribute to serious medical decline. Not in a sudden way, not loudly, but slowly, over time, in ways people don't recognize until things become severe. Here's what the research actually tells us. A 2022 review published in the Journal of the American Geriatric Society found that persistent dry mouth, clinically known as xerostomia, shows a 61% overlap with 4 of the most serious health threats in older adults. These include aspiration pneumonia, systemic infections, progressive malnutrition, and medication-related toxicity, conditions that together account for a large number of hospital admissions every year. And surprisingly, they can all be linked back to something many people wake up experiencing daily. Before I explain the 7 warning signs that dry mouth may be masking, I want you to understand Margaret's case because it's the reason this topic matters so much. If you're comfortable, you can even comment your age and whether you wake up with dry mouth, yes or no. You'd be surprised how many people silently deal with it without ever mentioning it to a doctor. Margaret was 71, a retired teacher from outside Columbus, Ohio. She spent most of her life taking care of others and rarely ever thought about her own health unless absolutely necessary. So when she started waking up every morning with an extremely dry mouth, she simply kept a glass of water beside her bed to get through it. She never told anyone. In her mind, it was just aging. Something normal. For a year and a half, this continued every single day. But during that time, subtle changes began to appear. She started losing weight without trying, just small amounts at first. Her daughter noticed her clothes weren't fitting the same anymore. She began struggling with dry foods. Then came repeated chest infections, one in spring, another in fall, and again the following winter. Each time she was given antibiotics and sent home, but no one connected the pattern. No one asked the deeper question, why does this keep happening? Then came the 3rd hospital visit. One morning, Margaret suddenly struggled to breathe. Her lips had a slight bluish tint, and her daughter immediately called emergency services. Her oxygen level had dropped to 81%, while healthy levels are usually 95% or higher. The diagnosis was devastating: severe aspiration pneumonia, developing not overnight, but gradually over months. To understand what happened, you need to understand something important. Every night during sleep, tiny amounts of bacteria from the mouth can travel toward the airway. In a healthy system, saliva acts as a protective barrier. It contains immune components like enzymes and antimicrobial proteins that help control bacteria before they can reach the lungs. But in Margaret's case, that protection had been significantly reduced. With very little saliva, that natural defense system was weakened. Over time, microscopic amounts of bacteria were repeatedly inhaled into her lungs during sleep without her awareness. This process, known as microaspiration, happens in everyone to some degree, but usually the body defends against it effectively. In her case, that defense was no longer working properly. The result was 19 days in intensive care, mechanical ventilation, and permanent damage to her lungs. But what makes her story even more disturbing is what her daughter later discovered. While reviewing medical records, she found that Margaret had been taking multiple medications for years without a full review of how they interacted together. Several of them, including a blood pressure medication, an antihistamine, and a bladder control drug, belong to a class known to significantly reduce saliva production. Individually, they may seem harmless. Together, they created a long-term suppression of her saliva. Her dry mouth wasn't just discomfort. It was a warning signal that went unrecognized for years. And this wasn't a rare coincidence. It reflects a much larger issue affecting a significant portion of older adults, especially between ages 65 and 75, and even more beyond that range. There are 5 major underlying factors that explain why this happens, and most healthcare providers rarely explain them clearly. The first is this: saliva is far more than just moisture for chewing or swallowing. It is a highly complex biological fluid made up of hundreds of proteins, enzymes, and antimicrobial compounds. It plays a critical role in immune defense, digestion, and protecting the throat and airways all at once. A 2021 study from UCSF involving over 12,000 older adults found that individuals with chronic dry mouth were nearly 3 times more likely to be hospitalized for respiratory infections within 2 years compared to those without it. That's a significant increase in risk for something many people dismiss as trivial. The second factor is even more concerning. Medication interactions are often overlooked. More than 500 commonly prescribed medications list dry mouth as a known side effect. Blood pressure medications, antidepressants, antihistamines, diuretics, bladder control drugs, and sleep aids are among the most common culprits. When older adults take several of these together, the effect doesn't simply stack in a straight line. Research published in the Journal of the American Dental Association in 2023 found that when multiple xerogenic medications are used at the same time, the impact on saliva production can multiply rather than just add up. In practical terms, 3 medications that each cause mild dryness don't result in 3 times the dryness. Instead, the suppression of salivary function can increase dramatically, sometimes 6, 7, or even 8 times greater than expected. This is known as the compounded xerogenic effect, and it is rarely addressed during routine prescription reviews. The third major consequence is something most people never connect to dry mouth at all: malnutrition, even when food intake seems normal. This often surprises patients. Saliva isn't just for comfort, it actively initiates digestion. It contains enzymes like amylase that begin breaking down carbohydrates, and it also sends early chemical signals to the stomach, so it can prepare the acids and enzymes needed for proper digestion. When saliva levels drop significantly, that signaling process becomes weak or incomplete. Food still enters the body, but nutrients are not broken down or absorbed efficiently. A 2022 Mayo Clinic study found that 44% of older adults diagnosed with unexplained malnutrition were actually experiencing clinically significant dry mouth that had never been identified as a contributing factor. In simple terms, you can eat full meals every day and still slowly become malnourished without realizing why. The fourth risk is even more serious. A persistently dry mouth creates an open pathway for harmful bacteria to move beyond the mouth and into the rest of the body. The oral cavity normally contains around 700 species of bacteria living in a balanced ecosystem regulated by saliva. When saliva production drops, that balance is disrupted. Harmful bacteria such as Streptococcus mutans, Porphyromonas gingivalis, and Fusobacterium nucleatum can rapidly increase in number within a short period of time. According to research published in Nature Reviews Microbiology in 2023, these bacteria are not confined to the mouth. They can enter the bloodstream through tiny breaks in gum tissue and have been associated with serious systemic conditions, including heart valve infections, worsening blood sugar control and diabetes, faster cognitive decline, and even sepsis in high-risk individuals. The fifth point is perhaps the most important to understand. Dry mouth is rarely an isolated issue. It is often a signal that something deeper in the body is being affected or overlooked. And this is where the 7 warning signs become critical. Before going into them, consider this: how many medications are currently part of your daily routine? If it's 3 or more, the next case is especially important to pay attention to. Robert was 68, a retired firefighter from Atlanta who had spent over 3 decades responding to fires and emergencies. A man used to ignoring discomfort. He didn't think much of waking up with a dry mouth each morning. He dismissed it and carried on. 2 years went by. Then the dental pain began. When his dentist, Dr. Simmons, examined him, she paused before saying anything. 8 teeth had been severely damaged by rapid decay over just 14 months. Damage so aggressive she had only previously seen it in patients undergoing radiation therapy. As she investigated further, she discovered that Robert had been taking a combination of acid reflux medication and a diuretic for blood pressure. Together, they had significantly reduced saliva production over a long period of time, effectively stripping away his mouth's natural protective barrier. But what she found next was even more concerning. She took a bacterial culture. What came back made her reach for the phone immediately. Robert's oral Streptococcus mutans levels were among the highest she had ever seen outside a hospital setting. And that wasn't a minor detail. A 2023 Johns Hopkins study involving 8,400 men between the ages of 65 and 75 found that elevated levels of Streptococcus mutans in the mouth were linked with a 34% higher risk of a major cardiac event within 18 months. That finding changed everything. Robert's cardiologist soon discovered early signs of arterial inflammation. His treatment plan was adjusted, his medications were reviewed, and his dry mouth was finally addressed directly. Today, Robert is stable, but he was reportedly within roughly 6 months of a serious cardiac event. In his case, a dentist asking the right question about persistent dry mouth is what likely prevented a far worse outcome. Now, the 7 warning signals. Signal 1, ammonia-like or chemical breath alongside dry mouth. If your morning breath smells metallic, sharp, or chemical rather than simply morning stale, it can be an indicator of kidney stress or reduced kidney function. A kidney function blood panel should be considered. Signal 2. Thick, sticky, rope-like, or foamy saliva. This is not just dryness, it reflects altered saliva composition and can point toward autoimmune activity. Conditions like Sjogren's syndrome, lupus, or rheumatoid arthritis may be involved, and autoimmune screening is often warranted. Signal 3. Dry mouth that is worst only at night or in the morning. If symptoms are mild during the day but severe upon waking, this often suggests sleep-disordered breathing such as sleep apnea. Mouth breathing during repeated airway collapse overnight can drive persistent dryness. A sleep study is recommended. Signal 4. Dry mouth combined with frequent nighttime urination. This pairing can signal blood sugar dysregulation or diabetes. High glucose levels draw fluid from tissues, including salivary glands, while also increasing urine output. A fasting glucose test and HbA1c are important checks. Signal 5. Dry mouth plus dry, gritty eyes. This combination is a classic pattern seen in Sjogren's syndrome, a condition that is estimated to affect about 1 in 70 women over 60 and is widely underdiagnosed. If missed, it can progress beyond the glands and affect organs such as the kidneys, lungs, and nervous system. Signal 6. Dry mouth accompanied by frequent leg or foot cramps. This can indicate an electrolyte imbalance involving sodium, potassium, or magnesium. The risk becomes especially serious in individuals taking diuretics, where imbalance can contribute to cardiac rhythm disturbances. Medical evaluation is advised promptly. Signal 7. Dry mouth that begins within 90 days of starting a new medication. This timing often points to drug-induced salivary suppression, particularly from medications with anticholinergic effects. This is a strong reason to request a full medication review, especially for polypharmacy situations. Now, what to do about it? Step 1 is a simple morning self-check. Before drinking anything, take about a minute and assess. Is saliva present at all? Is it thin or thick? Is there any unusual odor? And can you swallow comfortably without water? Tracking this daily creates useful clinical information. Step 2 is a full medication audit. Write down every medication you take and check whether any are listed as anticholinergic or xerogenic. Then request a formal polypharmacy review focused on anticholinergic burden. That specific wording helps shift the discussion into a clinical evaluation. Step 3. Hydration alone is not the solution. Saliva production depends on electrolytes like sodium, potassium, and bicarbonate. Drinking only plain water can further dilute these levels. Small, consistent fluid intake combined with electrolyte-rich nutrition is more effective. Step 4 is nighttime protection. Elevate the head of the bed by 4 to 6 inches using proper risers. Maintain indoor humidity around 40 to 60% with a cool mist humidifier, and use a xylitol-based dry mouth rinse before sleep, avoiding alcohol-based products. Step 5 is natural saliva stimulation. Chewing xylitol gum after meals using sugar-free sour lozenges and including crunchy raw vegetables can help activate salivary glands in a safe, clinically supported way. Step 6 is how to communicate with your doctor. Use clear clinical language such as, "I'm experiencing chronic xerostomia that is affecting my sleep, swallowing, and nutrition. I'd like to review whether my medications are contributing and assess salivary gland function." This framing improves the quality of response you receive. Step 7 is the emergency warning list. Dry mouth with difficulty breathing requires immediate emergency care. White patches in the mouth may indicate oral candidiasis and should be evaluated promptly. Dry mouth with sudden confusion or weakness, chest pain, or rapid heartbeat requires emergency services. Unexplained fever with dry mouth should be treated as urgent same-day care. Now to address a few thoughts directly. If you were told this is just aging, that explanation is incomplete. Clinically significant dry mouth is usually linked to medications, underlying conditions, or a combination of both. Aging alone is not considered a sufficient cause in most clinical contexts, and increasing water intake alone will not resolve it. Dry mouth is related to salivary gland function, not simple hydration levels. You cannot compensate for reduced gland output by drinking more water. Even denture wearers are not exempt. In fact, reduced saliva can increase bacterial buildup under dentures and along gum tissue, raising systemic risk even without natural teeth. Now returning to Margaret. After her ICU stay, she returned home significantly weakened, but her daughter began systematically reviewing everything: medications, symptoms, and overlooked interactions. Adjustments were made, and one medication was discontinued entirely. Within 6 weeks, her dry mouth had nearly resolved. Within 3 months, she had regained much of the weight she had lost and her overall strength improved. Today, Margaret volunteers at a senior center twice a week. She distributes a simple laminated card listing the 7 warning signals. Over 200 copies have been shared so far. And every time, she says the same thing. She thought it was nothing, and it nearly cost her everything. The message she repeats is simple: don't ignore it. This is NanoNexus science. The goal of these reports is simple: clear information, grounded in research, explained in a way that can actually be used in real life. No one should have to fight to be heard when a symptom is trying to say something important. If this applies to you, consider taking it seriously now rather than later.